Hello everyone, we are from group number 2 and our members are myself, Phurba Wangdi, and my friend Namphung. The topic for our presentation is we are going to talk about the new approach to treat antibiotic resistant bacterial infection. So we know that bacteria can cause different kinds of infection, and among many infections, the wound infection is one of the most common infections caused by the bacteria. Currently, there are different kinds of antibiotics available which can treat the bacterial infection, but the prevalence of antibiotic-resistant bacterial infections are becoming very much higher, which results in causing a chronic wound infection. And moreover, the bacteria has their different kinds of mechanism, like they have a tendency to form a biofilm, which again makes them more persistent against the antibiotic treatment. And the biofilm, it is a cluster or it is a group of the bacteria which they get attached to the surface of the wound and they become more persistent towards any kind of antibiotic treatment. And this is the phenomenon how the biofilms are formed. We know that the planktonic bacteria, it is called a free-moving bacteria, and they have a different kind of structure. And one structure that bacteria have is like they have a hair-like structure on the surface, which is called a pili. And with help of this structure, this get attached to the surface of the wound, and then over the time they can form a small group, which is called as microcolony. And the bacteria, they have a different kind of the coordination mechanism among themselves to coordinate to develop into full mature biofilm. And the most important feature of this full mature biofilm is they have a very strong outermost protective layer, which is called as a matrix. And this matrix, this is the reason why it makes the antibiotics ineffective. When antibiotics are applied or given in this wound infection, because of this matrix, it cannot penetrate inside the biofilm, so that the bacteria inside the biofilm, they remain alive and they are not treated, thereby causing the wound infection. And our approach is we are going to use a magnetic iron oxide nanoparticle. And the most important thing about this nanoparticle is that this nanoparticle can disrupt or destroy the outermost layer of the biofilm, which is called a matrix. So after destruction of this matrix or the outermost protective layer, and after destruction, when we apply or when we give the antibiotics, these antibiotics can now enter or penetrate inside the biofilm, and it can kill the bacteria inside the biofilm. So this is the overall conclusion of our our presentation. So we know that our normal wound healing, which is caused by the different factors, they are challenged by the different kinds of factors, and among all, the one we talk about is the biofilm. Because of the persistent nature of the biofilm against antibiotics, it results in wound infection, chronic wound infection. And after that, the most protective layer of the biofilms are destroyed by the nanoparticles, it can increase the efficacy of the antibiotics, which can overall result in the enhanced wound healing, which is otherwise called a restored healing, wound healing. Thank you very much to all the staffs and staff of SID 504 and Medical Education Technology Center. Thank you.